All right, here we are again. It is May 6th. So that means we're on the 6th day of the mouth breathing awareness campaign that I started to bring awareness to myofunctional symptoms because they're really underdiagnosed and underrecognized, right? So if we can start talking about a simple thing like mouth breathing, which is so common, now maybe we can start helping more patients get all of these things recognized. So I've got Nicole Coppaway here. Hi, Nicole. And instead of doing the Instagram live, we just went straight to Zoom because I think it's easier and it's, we don't have to deal with the technical stuff. So I'm so happy that you ended up taking my MyoMentor program, and I'm even happier that you wanted to share your story. But let me introduce you, and then I just want you to go for it. So I know you're Canadian. You're from outside of the Toronto area. Let me see, I wrote it down, Burford, Ontario. And you have a private dental hygiene practice called Floss Fit, which is so cool. And now you're incorporating myofunctional therapy into your dental hygiene practice. So I'd love for you to talk about that. I want you to share you're a lot like me, like you got into the field and then discovered you had the issues. That was my path too. So yeah, take it away. Start from wherever you want.
Okay, sounds
good. I'll probably ask questions and interrupt along the way.
Okay, great. So I didn't know what myofunctional therapy was at all, but a colleague had mentioned it and it wasn't anything I'd heard of before. Sometimes I feel like we get into that continuing education rotation.
Yeah, you just keep learning.
Yeah, I just kind of went out on a limb and took that course thinking it could help me, especially since I was considering moving into an independent practice. So I took that in Toronto in 2018, and it was eye-opening, but I also kind of wondered, I didn't even recognize the symptoms in myself at that point.
Yeah, so crazy.
It didn't seem, they'd evaluate us too, and they'd say, okay, there's a little bit there, but nothing really obvious. But having learned more and maybe been a little bit more tuned in to what's going on with myself, I realized that I definitely do have some things going on.
And I kind of put the pressure on people in my class. I'm always like, okay, you guys, you have to help yourself first, right? Like really be honest with yourself. Do you think you have a tongue tie? Do you think your mouth is open? Even just a little bit, like we all have to come to that realization. So I don't know if it was my course that helped you figure that out or not, but
it was. I think looking at the functionality of the tongue and paying attention to compensations, if you're able to get that movement and achieve a certain posture, great, but how much are you compensating in your neck and your face, and paying attention to what muscles are really fatigued and how you're feeling after.
Is that what started the tongue exercises got you into it?
It did. I suspect I do have a posterior tongue tie. And also, like, I should back up really, my story began a lot longer ago, I guess, when I was really little. I had a dentist who I want to say was a little more forward thinking, and he recognized some malocclusion. My teeth weren't aligning properly, and I had a bit of what people would say is an overbite. I had a class 1 on one side and a class 2 on the other. So at that point, the dentist suggested doing a rapid palatal expander.
Okay. How old would you have been?
Oh, I think I must have been about 8 or 9 at that point. It was a removable appliance, so I'm the first to admit that I might not have been the most compliant, but even at best, correct me if I'm wrong, but the most you'll get is 3 or 4 millimeters of movement with RPEs typically, or is that not?
I don't actually know. That's a good question. I'd have to ask somebody else.
I think that's the concern with the palatal expander. Sometimes it's not enough, so then relapse happens really easily because your tongue can't make it up into that spot to maintain it, and so you're left with
for sure.
Anyway, I'm speculating, but when he prescribed that or started that treatment plan, he said, you'll never need braces if you get this appliance.
Yeah.
Well, I'll tell you, I needed braces. We should mention too, palatal expanders are typically expanding laterally, right? We're getting from there, but we're not getting any forward growth. So years passed. Didn't wear the appliance any longer. My tongue, I'm positive, was not in the roof of my mouth holding that space.
Back then, did you have allergies? Did you have any breathing issues like as a kid when you were younger?
Not that I remember, but I wasn't aware of a mouth breathing habit. But what I can say is that since I was little, I remember my mom always saying to me, stand up straight, Nikki. You look like a question mark when you stand. And I would always have slumped shoulders and my head would be back. So probably mouth breathing.
Yeah, probably.
Yeah.
And I mean, even if it's not mouth breathing, if the tongue is low and the mouth is open, it's really the same thing, even if you're nasal breathing. So
right, yeah, which might have been the case, nasal breathing. But I sighed a lot too. And with the Pico breathing course, they say pay attention to people like a sighing habit. And I would hold my breath almost and let out this sigh. And I know they reminded me of that a lot too, but I didn't know there was anything that was a red flag.
Definitely dysfunctional breathing, right? Breath holding or even nasal breathing for like 2, 3, 5, 10 minutes and then doing one big mouth breath. That's also dysfunctional breathing, and that's super common. So mouth breathing doesn't have to look like the Napoleon Dynamite mouth breathing face that Kimmy talked about in her interview. But I mean, it can be, but that's more extreme.
Right. Yeah. So it was a less obvious type of mouth breathing, I think. So I ended up years later I think I was just in for a regular dental appointment, but we had switched dentists and moved to a new city. So they were catching up on x-rays and noticed that my canines, my upper teeth, hadn't dropped in yet. And I was 13 at that point.
Oh, okay.
That's too late, a little bit, or at least behind.
Yeah.
Everyone's different. So when they went to take some x-rays, some specific ones that investigated as to where they went, and it turned out that they were erupting on top of my permanent teeth elsewhere. So they weren't coming down on top of the primary baby tooth where it should have been. It had moved forward. They had both moved forward and started coming down, and they severely damaged the roots of those teeth.
Oh no.
Unfortunately. So it was it would have been nice to find out about that ahead of time and redirect those teeth or intervene somehow. But they didn't. So I ended up having those lateral teeth. So those are the ones right next to your front teeth. Those were taken out. And they also had to take out my primary or baby canine. So those two as well. So in high school, I had 2 front teeth and then 2 spaces on either side. And I just didn't have a very pretty smile.
Oh no. And in high school, that's like so traumatic.
I'm sure that's a good memories. High school, yay. When I worked at McDonald's, our motto was smiles are free. So that added.
Oh my gosh. Jeez.
Yeah, but okay. Not to feel sorry for me, but it's just interesting to look back at this, and I'm seeing some of the same patterns in my children. I have 2 boys, and they're 8 and 7. And my youngest has constant open mouth rest posture. So I opted to sign him up for myofunctional therapy, but with a different therapist because our children.
That's so smart of you. I mean, I know we all want to work on our family members because we can do it for free, but oh my gosh, it's hard, right? Because you're just mom. You're not like a specialist,
Already bossy about a lot of other things, so they don't want to listen to me on that.
Who are you working with? Because I know Kim's in your area.
Yeah, Kim comes.
Yeah, awesome! Yay! I want to interview her. I hope she'll want to share her story.
That would be neat. Yeah, she's been so far, and he's listening. We're using the Munchie with him. He's got sleep disordered breathing, so we've been waiting to get into an ENT to have that evaluated. But anyway, I was also bringing both of the kids, or we had set up appointments for a functional orthodontist or orthotropic dentist. And it was interesting to hear different perspectives. I've spoken to a couple of different dentists in our area, but when I explained what had happened to me, he said, oh, all you would have needed was forward growth and those canines would have been in the right position. And Mike Me also did that webinar recently, he showed a photograph of a child, and I'm sure lots of people have seen this on kids where their canines come out on really buccally. They come out way
Yeah.
further forward than you think they're supposed to be. But he
Totally.
said, which teeth in this picture are in the correct position? And
And
it's
it's the canine. Yeah.
wow.
Yeah. Well, I think it's really cool. And this is what I love about all of you guys who are parents who get into this. And then you realize, oh my gosh, the stuff I dealt with is actually not normal, and it's actually preventable. And now I can help my kids avoid these things that I had. And now your kids can be better off. So it's really interesting that you're now seeing it with your son, who you said he actually was diagnosed with sleep apnea.
Not yet.
But
He
you're pretty you
coughs and
suspect it.
turns and has a lot of symptoms. He snores and grinds his teeth. Not snoring constantly, but always sleeps with his mouth open. So
It's so common. Yeah. But imagine if you're just a mom who didn't have any of this training. It could have gone on for years and it would have never been caught, right?
Yeah. I think that has to be it, because at this point, to fix some of my own problems would be pretty invasive, I guess.
Yeah.
Or developing forward growth. So I think focusing on the next generation and teaching parents signs that they can look for and pay attention to.
Yeah. Do you feel like, I mean, I'm sure you've worked on this, or you're currently, retraining yourself, but have you worked on, or I have multiple questions here, but I guess the first one is, did you notice mouth breathing at night? Because you didn't really connect with like daytime mouth breathing, but when you would sleep before you knew any of the stuff, or before your first class, did you have your mouth open?
I'm not sure if it is a constant habit, but I know that I've woken up a lot of times with a very dry mouth. So
yeah, I used to too, man. I would sometimes feel like my mouth was just cardboard, like you'd wake up and it'd be so dry. And no, I can't imagine doing that now. And, you just think, oh, well, that's just how it is.
And that's another connection that we can use as a dental hygienist to help our patients too, because so many patients are dealing with dry mouth and they don't know it. They say their mouth isn't dry, except for maybe in the morning, or they'll wake up in the middle of the night and take a drink of water.
Yeah.
But then they're also dealing with caries, like cavities.
And perio issues, like we haven't really talked about that. I don't know, you have your own dental hygiene practice. Do you want to kind of make some connections like with tooth decay and gum disease for people? That might be cool.
With respect to mouth breathing?
Mouth breathing, yeah.
Yeah. So I do use pH test strips in my office cool. As part of a new patient screening tool. It's pretty eye-opening, amazing, like to learn what your mouth pH is, and to talk about things with patients like not all water is the same. Some of the water that we drink is really acidic, or adding
that's so interesting.
We think that we're really hydrating our mouths, which is great, or having that alkaline balance when we're drinking water with lemon, but it does lower your pH. Eating constantly lowers your pH too, but that dry mouth keeps it lowered all day long.
Really? Okay.
Yeah, your saliva doesn't have a chance to neutralize it anymore, because there is saliva.
And of course, so between like the changes in pH and then just the dry conditions, that's going to increase so many problems. So
the inflammation, usually, like for kind of the Napoleon Dynamite reference type of mouth breather, you can usually see really red, angry gums.
Yeah.
But they always look like that. But yes, across the front teeth, they look like they're just so dehydrated. You could just quickly brush them and they bleed.
Yeah. No, that's so perfect, because, you got that. Like, I love that you're integrating the myofunctional therapy into a dental hygiene practice. I think the two go hand in hand so well. Do you want to just talk about, this is more from a professional perspective, but how do you structure your appointments? Do you have like myo days and hygiene days, or how have you integrated that into your clinic?
So I don't at this point, but I opened up my practice in 2018 at the very end of the year. So I've been open for about a year and a half. I am the receptionist and assistant and hygienist by myself right now. So
I know how that goes, yeah.
but for the most part, the days offer enough flexibility that I can see both dental hygiene. Now, that being said, things may change after isolation and
Yeah,
restrictions are lifted. I'm not sure what that's going to look like yet, but I think myo days might be in my future.
totally. Yeah, because I mean, it's at least as hygienists, we can help our patients in these other ways, even if we can't technically do clinical hygiene because of whatever the COVID situation is. At least we can do telehealth doing this online, and it works
Yeah,
great, you
I
know.
have started with some patients online,
Cool.
and
That's
it's been
exciting.
going well. It's neat to see the differences after, being in therapy. And that's probably important to mention too for everyone who's new to myofunctional therapy. We can't expect results overnight. So
Yeah.
that you usually teach that 12-week program, right? It's not just a couple of sessions and then you're
Yeah,
done.
12 sessions even. So there might be 2 weeks between at least
Oh, sorry.
for,
Yeah, I meant 12
yeah,
sessions. Yeah.
because I mean, then the therapy can last up to a year potentially with check-ins at the end. And yeah, it's not a quick fix. It takes work and a lot of energy and commitment and dedication to changing these habits. And that is super important for patients to know. It's not just like, oh yeah, look on YouTube and do these 5 exercises and you're cured.
Right.
Not so simple.
Yeah, myofunctional therapy to me is kind of like having a personal trainer because you have accountability and someone there to cheer you on or remind you or give you that,
For sure.
that game plan too, as opposed to just
Mhm.
going in. It's like going into the gym and doing a couple of exercises for a few weeks and then you might just,
Well, giving you feedback, right? Like you're
yeah,
talking about the compensations, like you can do an exercise that you found online or read in a book, but if you don't have anybody to give you feedback on how you're doing it, you might not be doing it effectively at all. So, yeah.
good
No,
point.
thank you. That's great. I think you've given us some good information. I'm just trying to think if there's anything else you can add. Maybe what's the treatment plan for your son who has the sleep disorder breathing? What are some of the next steps you guys are taking, and what are some of the things that Kim's recommended?
Okay, so we're in the first week so far. We've met with Kim and then we're into the first set of exercises.
Okay.
He is using the Munchie, and I have to say, when people are struggling with lip seal, he has a bit of a more of a gummy smile. I think he's still adorable, but
Mm,
he does have a gummy smile.
yeah,
So
of
his
course.
lips don't naturally close. So to put the
Mhm.
Munchie in his mouth, we're starting off at 2 minutes.
Mhm.
So he tries to hold it closed for 2 minutes, and it's hard for him. But
Yeah,
it'll get
super
easier.
hard, but it'll get easier.
Yeah,
And I'm glad you mentioned the Mile Munchie because I think it's so helpful for kids. How old is your son?
he's 7.
Okay, he's right in that perfect age. So he's
Hmm.
old enough that he can actually do exercises, but he's like young enough that he's still growing and he's got lots of like time to, have
Yeah,
everything come together.
yeah. I'm thankful that we found myofunctional therapy when we did, and
Oh my gosh, yeah.
I almost wish I could go back in time still, but that's okay with the kids. He's
Yeah.
also, what else? Oh, the toothbrush exercise. So brushing the tongue, brushing the roof of your mouth, and then sticking them together. But again, we're suspecting a posterior tongue tie with
Yeah.
him, and he struggles with getting his whole tongue up to the roof of his mouth. He can do the front, but I don't think he's making it all the way up.
Yeah. It's so hard to know in kids if that's actually happening or not. It takes, kind of being a detective and figuring out, what exercises can they do, how are they doing with the postures overall, and then, kind of going from there. So, yeah.
Yeah. And can you just talk about snoring a little bit, like in kids? He's
Yeah, snoring is never normal or healthy in kids because
or
typically it's a sign of mouth breathing. I mean, you can snore breathing through your nose, but if you are, then that probably means there's some sort of soft tissue dysfunction going on as well. Is that what you mean? Or you should talk about it, not me.
I was curious to hear just that link. And it popped into my head because on Facebook recently I saw someone post something like, put up your hand if you can't sleep anymore because your husband snores so
Oh,
loud.
geez,
Oh,
yeah.
no, that's not good.
No. There's a book. Have you read Sleep Wrecked Kids?
Not yet.
That's really good. It's by Sharon Moore, and I feel so lucky enough that I can call her a friend, and I got to meet her and lecture with her in Australia. And her book is awesome. So I think it's really good for families. That would be one I would stock like in your clinic and give to people because it's I think really helpful for parents, and it just helps you realize what's normal and what's not. So
Is there one
yeah.
you would recommend for adults?
Gosh, so many. Jaws. I think, what's Michael Gelb's book? Gasp. I think some of these, they're really simple books, but they put it together. So if you already know this stuff, you're going to read it and it'll make perfect sense. It'll kind of reinforce what you already know. But for patients who've never heard it, I think they're really good. So Gasp, Jaws, 6 Foot Tiger, 3 Foot Cage. That's kind of one of the old original. I feel like that one came out like 10 years ago. It was kind of the first book where people were like, whoa. Tongue Tied by Richard Baxter. Those are all good.
Okay, great.
Yeah. Yeah. Well, thank you for sharing. Do you want to give any shout outs to anyone, like dentists you work with, or anybody who's kind of helping you with this in your area?
Yeah, definitely. So I've had to kind of source out people because it's not very big in my area. So I'm the only myofunctional therapist around locally. Kim Kung is pretty close to me in Kitchener, so she's about an hour away. Mm-hmm. I work with Dr. Melissa Gambacorda, and she's a dentist working in some functional orthotropics and helping functional growth and having teeth come together properly to facilitate that growth naturally. She's a huge proponent of body work as well, so working with osteopath or craniofacial
therapist. Is she doing tongue tie releases, or have you found a provider for that?
She is doing tongue tie releases. I think most of my clients that I've had have been in that tricky age though. They're not quite
like 0 to 3
beyond. Yeah, unfortunately. So we haven't been able to do any, but that's okay when they're older.
Yeah. Actually, I know what you mean. Even 4 and 5 can be really tricky because they're obviously not babies, they're not breastfeeding, they're not in that age group, but they're also not quite old enough to really understand why the exercises are important. And I know she can talk about that from when her son had it done and her story around that a few years ago. So maybe I'll ask her about it when she's on. All right. Well, thank you so much for sharing your story. I really appreciate you connecting the dots to some of this dental stuff. I don't think anybody's really put that spin on mouth breathing as much as we talked about today, which I think is super helpful for parents listening, for other hygienists and dentists listening. I think all this information, if we can just get it out there, then we can make big changes, right?
Definitely. Thank you so much for having me.
Yeah, thanks for being part of it. All right. Talk to you later.
Bye, Sarah.